Good morning, Board of Directors. My goal for today is to point out what is important for the moral right to health care. The first part of this presentation is about Code of Ethics. Having ethics is very important in healthcare. Not only does it make your patients feel comfortable with a doctor and the treatment they are receiving, but allows the patient to be able and comfortable to make medical decisions a lot easier. There are 4 ethical principles in healthcare that I am going to discuss and go into detail why these principles are important in patient treatment. And I'm going to try to get y'all to understand the reasoning of each principle that will explain the importance in a healthcare facility and staff. The first ethical principle is autonomy. Autonomy means self-determination. In healthcare, this means that the physician cannot treat a patient without their consent. And this also allows for the patient to accept or reject recommended treatments. But decisions about appropriateness and effectiveness are domain of the physician. The second ethical principle is non-maleficence. Non-maleficence means first do no harm. This one can be a tricky code of ethics for the reason being you have to look at the pros and cons of treatment. For example, if a patient comes in needing their appendix removed, but their heart may not allow for the surgery, given if the surgery is done before the appendix ruptures, then it is a quick surgery and the patient will survive. But if you get in and the appendix does rupture, that there will wind up putting more strain on the patient's heart, therefore making the surgery a little bit more difficult. Benevolence means for healthcare professionals to do good. This code of ethics is about what treatment is best for the patient and making sure that the patient understands and that someone is also acting in the patient's best interest. Now, this one here is another tricky one for the plain and simple fact is you could have the patient agreeing with what you want and then someone else saying, no, that's not what you need. It's not the best thing for you. And the doctor knows that this is the best treatment for them and you know that they're not being guided right. You can actually try to override that person. And the fourth and final ethical principle is justice, which means fairness. Now, there are 2 different types of justice in this code of ethics. The first one is disruptive justice, which is the allocation of resources, and the second one is prejudicial justice, which is fairness, transparency of progress by the decisions are made. Having at least one of these 4, or maybe even all 4 of these ethical codes is really good for a healthcare facility and for the staff, because not only will it make your patients feel a little bit more comfortable about coming in, but they gain that trust in the facility and they know that when they come back, they're either going to get that type of service or they're going to get someone who's going to do a lot better for them. The second part of this presentation is resource allocation. What is resource allocation? Resource allocation is one of the biggest issues in healthcare. The reason being is because physicians want to be fair to all their patients, and so do facilities, but limited funds and limited medical treatment is always a problem. How do you determine who gets the medical help they need? Well, you have to go based on the patient's symptoms, their history, and their medication. How to be able to control your budget. And this one here, in this section, I will list 2 settings that you need to try to implicate and see which works best for you. And then how to prevent resource allocation by judging the best that you can. How do you determine who meets the needs under patient allocation? Now I have two examples here. One is a transplant patient, and two is two elderly patients who have come in who need hip replacements. You have to determine based on their medical need who is going to be the best candidate for the organ transplant and the hip replacement. For the organ transplant, choosing which patient gets a transplant is very hard. The waiting list for organ transplant grows every day. The patient has to wait months to years for a donor match. Then when you get a donor match, if your lab work is not done, it's not good enough for the transplant, then you will be stuck on the list and the organ would go to someone else next on the list. Now, to prevent the problems is, let's say you know someone who is a match and they are willing to donate a kidney to you because you can live with just one kidney. Getting that done as soon as possible is the best thing to do. But also, too, in the longer you wait, the more high of a chance that you have of your body rejecting the new organ. And when that happens, you have to go back on the transplant list until you can find someone else. Now, for the hip replacement, you have two patients that have come in. One is a very healthy patient, and another patient is on blood thinners. Well, the patient on blood thinner, you have to wait a few days in order to get their blood stable enough to where they can get surgery and not worry the risk of bleeding. That patient there, you would be more likely able to transfer to another facility. Whereas the healthy patient, you can take them right up to surgery and perform the surgery on them without having to wait days. But you also run in the risk of them bleeding as well, as much as the patient on blood thinners would be. But if that happens, you already have them in the operating room and you know that you can stop it without an issue. Steps to prevent resource allocation. How do we prevent the gap in resource allocation? One, by setting limits. By facing the fact that you cannot treat everyone and some patients have to be referred to another facility or physician. By doing this, you are making sure that the demand does not exceed the supply of treatments. Knowing your boundaries, knowing your cut. Just like I said in the previous slide. Which one can you take up now? What's the best option? Who can wait? Who cannot wait? And another one is medical fertility, by weighing the odds of the chances of a successful treatment. Which means, like I gave in the example of the last slide, you could refer the patient who is on the blood thinner out to wait a few days to get their surgery going. Or you can take the chance and do the patient who is in good health and then bleeding out. You never know what's going to happen in medicine. You never know what's going to happen when you start treating a patient. So it's one of those things that is a 50-50 shot you have. But by doing at least one of these two steps, you will cut back on exceeding the supply of treatment. Stark Law. What is Stark Law? I will explain what is Stark Law and how it came about, what happens when you violate the Stark Law, and the importance of following the Stark Law. Stark Law is where a physician refers a patient to another facility in which the physician has a financial interest, investment, ownership, or compensation. When a physician self-refers a patient to another facility, it can lead to overutilization of healthcare services. This can lead to increasing healthcare costs and a limit referral system with lack of competition. Stark Law was created for Medicare and Medicaid. There is a strict regulation of referring a patient to ensure it does not violate the Stark Law. This here is a very big one because people are sending someone out and they're getting a kickback from sending them back out for a research that the patient has no clue about, which is depriving your government of money. And it's not really fair to the ones who really need the treatment and are trying to go the legal route to get it, and they can't. The violations of Stark Law. No billing. Under the Stark Law, an entity pursuing a service as a result of a prohibited referral is not allowed to bill Medicare or Medicaid, the patient, or any third party. If you are caught or if you know that this is going on, legally you are not supposed to bill them. This is considered a pro bono case that you're supposed to be doing. The second one is refunds. The law provides that any payment received for a prohibited referral must be refunded. If you did get away with it and now you are caught, you do not refund that money. That's more trouble you're going to get into. Because not only do you have to refund the money that Medicare paid, but you have to refund the money that you got the kickback off of. And denial of payment. Payments by Medicare or Medicaid for designated health services that are furnished in violation of Stark Law is also denied, which means that you will be kicked out of being able to receive programs through Medicare or Medicaid. You also have penalties up to $1,500, which is civil money penalties, up to $15,000 per service may be imposed upon entities submitting claims in violation of the law and those that fail to make required refunds. And then you have penalties of up to $100,000 may also be imposed for circumvention schemes, where physicians or entities enter into arrangements that have principal purpose of ensuring referrals to an entity in violation of the law. And physicians and entities that violate the Stark Law can also be excluded from participating in Medicare and Medicaid programs. How do you prevent this from happening? You make sure, like I said earlier, your physicians are following the law. They are doing what they are supposed to do. Before the referral is sent out, you have someone checking it, making sure that the paperwork is correct for the referral. Then once you do that and you know that everything is legal, you're not going to run into the risk of any violations. I would like to thank you for your time today. If you have any issues or questions, I am willing to answer them at this time. Thank you, and you have a good day.